Hello, my name is Brandy Carter, and this is a PowerPoint presentation for my Capstone project entitled Overcoming Barriers to EHR System Adoption. Here's some background data on the subject of my project report. The Arkansas Department of Health In-Home Health Unit, located in Osceola, Arkansas. In 1878, a temporary ADH Board of Health was created to defend Arkansas borders against the yellow fever epidemic spreading throughout New Orleans, Louisiana. The initial Board of Health derived from the Little Rock-Pulaski County Board of Health, which Governor William Reed Miller eventually changed to the State Board of Health in 1879. Years later, in 1881, the State Board of Health was officiated by the state legislature, though it became inactive until the emergence of smallpox in 1897. On February 25th, in 1913, Act No. 96 was enacted, and this led to the creation of a permanent State Board of Health. Act No. 96 went further to ensure that a national board would make all necessary and reasonable rules and regulations in order to protect the public health by suppressing, preventing infections, contagions, and communicable diseases, as well as to properly enforce necessary quarantines to control disease. In 1968, the ADH In-Home Health and Hospice Services was created to address the growing need for in-home health care and includes such services as home health, personal care, mother-infant assistance, hospice care, and case management services. The Mississippi County Health Unit in Osceola, Arkansas is a local chapter of in-home health services for the northeastern region, and it helps to meet the growing demand for in-home health care. Yet to meet this growing demand for in-home care, healthcare facilities began to require more technologically advanced healthcare initiatives. In the early 1960s, electronic health records were invented to streamline patient care. An electronic health record is a digital version of a patient's paper chart that allows authorized individuals to access a patient's records quickly and securely. In 2009, the American Recovery and Reinvestment Act was initiated, and President Barack Obama incorporated the adoption of EHRs into the Health Information Technology for Economic and Clinical Health Act, HITECH for short. This act provides healthcare providers financial incentives for meeting and maintaining meaningful use standards. The issue is that, like many healthcare facilities, the Osceola In-Home Health Unit has been slow to adopt EHR systems in order to establish meaningful use. What is meaningful use? Meaningful use sets specific objectives that eligible professionals and hospitals must achieve to qualify for Centers for Medicare and Medicaid Services incentive programs. Meaningful use is using certified electronic health record technology to improve quality, safety, efficiency while reducing health disparities, engage patients and family, improve care coordination for public health, and maintain privacy and security of health information. Meaningful use hopes to ultimately result in better clinical outcomes, improved population health outcomes, increased transparency and efficiency, empowered individuals, more robust research data on health systems. Project purpose. Nationally, the Arkansas Department of Health In-Home Services has suffered a 28% decline in patients, an 18% decline in revenues, and a 19% decline in the number of employees over the last 5 years. By improving and increasing the use of its EHR system, the Osceola In-Home Health Unit could meet meaningful use standards and increase patient enrollment, improve documentation efficiency, improve overall patient care, decrease unit costs, and increase profits through incentives. There were a number of location-specific problems found while doing research for this subject. For starters, though the EHR system was adopted in the past 10 years, it has not been utilized regularly. The unit is comprised of a small staff, which requires that each staff member do a lot more work, which makes it harder to streamline patient care. Although the staff have been trained on the CHR system, there is limited ongoing training and newer staff members receive less training. Some team members are not as computer savvy as others and therefore shy away from using the system regularly. This makes it very hard for the facility to meet meaningful use standards. The research methods used for this project were a careful analysis of a 2014 financial report which outlined some of the budgetary constraints for Mississippi County in-home health. Survey data was analyzed to determine how employees felt about training provided for their EHR system and its overall usefulness. Lastly, the information was compiled into an overall report analysis to determine which changes could help improve EHR usage. Here's a small sample of the questions asked on the EHR survey provided. The survey was comprised of 23 questions overall. The complete questionnaire is included as an attachment in the project report. The research findings found on the 2014 financial report was that around $85,645 of the billable services provided by staff were unrecoverable. This loss was comparable to the typical yearly salary of one health services specialist 2 and one full-time registered nurse. Some of the survey findings were that 80% of the respondents feel the EHR systems were useful. 80% desired further training. 60% of respondents were comfortable with computers, while the longest tenured employees ended up with the most training. Here are a few graphs that represent some of the survey findings. The survey itself had a 62% response rate. This means that I received responses for 5 of the 8 surveys that I distributed. For the question on whether respondents would like additional training, 80% felt that additional training would be beneficial. But when asked what type of training, the responses were mixed. Each respondent had different ideas about which training method would work for them. Another question asked respondents for their level of comfort with technology. While 60% were very comfortable, 20% were somewhat comfortable, and one user was not comfortable using technology at all. Questions 11 through 21 asked that respondents select whether they completely agree, generally disagree, completely disagree, or don't know how they feel about a series of statements regarding their EHR system. Responses to these questions revealed that respondents had mixed emotions about the usefulness of electronically documented health records, although the majority feel positively about the system they have in place. For example, on question 11, 80% of respondents felt the use of the EHR system enabled them to accomplish tasks more quickly, while 20% generally disagreed that the EHR system simplified or expedited their workload. One of my recommendations for the health unit is to obtain additional EHR training offered by the local EHR vendor. Some cost-effective methods for obtaining additional training is to employ one super user, to obtain off-site training, to take advantage of low, no-cost distance training, or to obtain online training through the regional extension centers. The unit can also seek additional training opportunities by connecting with the Health IT Workforce Development Program, which is funded by the Office of the National Coordinator for Health Information Technology. The training options available for the Osceola in-home health unit includes online training, distance or local training through a college or university, and on-site training provided by their local vendor. The second recommendation for the health unit is to meet meaningful use requirements in order to obtain financial incentives. In order to do this, staff should learn more about the EHR incentive payment timeline. They can contact the Arkansas Foundation for Medical Care to obtain free technical assistance and to help them learn more about the stages of meaningful use. There are 3 stages of development for obtaining meaningful use. Stage 1 involves improved data capture and sharing. Stage 2 involves achieving advanced clinical processes. And Stage 3 involves showing improved patient outcomes. As you can see by the timeline, these stages began in 2011 and are expected to end in 2016, which means that there is no time to delay. Let's go over the criteria used for these recommendations. Feasibility. I believe that the recommendations are feasible because much of the training can be conducted during normal working hours. Staff members can train on-site through written or online coursework, while some staff members can choose to train off-site at a community college or university. Cost. There are a number of free resources for EHR system training available. Free and low-cost training can be obtained through the Health IT Workforce Development Program, the Regional Extension Centers, and the Arkansas Foundation for Medical Care. Urgency. I would say that additional training should begin as soon as possible in order to take full advantage of all that's available. Both the training programs and meeting the stages of meaningful use are on a timed schedule, and many of the free training programs are being initiated for only a limited time. In the words of the inspirational author Alan Cohen, do not wait until the conditions are perfect to begin. Beginning makes the conditions perfect. This concludes my presentation. Thank you so much for taking the time to listen to my explanation of how to overcome barriers to EHR system adoption. Thank you.